Welcome to Holmes on Health, the podcast where nutrition, fitness, and hormones meet health span, and science meets real life. I'm Dr. Alan Holmes, a recovering emergency physician turned expert in hormone optimization, metabolic wellness, and living life fully optimized. Each week, we dive into the tools, truths, and evidence-based therapies that help you build a stronger body, sharper mind, and more vibrant life. Whether you're curious, confused, or already optimizing, you're in the right place. Thank you for being here. Let's get into today's episode.
Hello, and welcome to this episode of Holmes on Health. I'm Dr. Alan Holmes. Today, we're going to dive into a condition that affects millions of people. Oftentimes, these are women. This condition is often very misunderstood, and therefore it's oftentimes misdiagnosed and mistreated. Today, we're talking about hypothyroidism. We're going to talk about how the thyroid gland works, why people develop hypothyroidism, different types of hypothyroidism, as well as different treatment options. And we're going to touch on some recent FDA comments about thyroid medication. So my goal today is to make this clear, simple, and practical. So with that, we'll get started. So how does the thyroid actually work? Well, first of all, what is it? It is a small butterfly-shaped gland in your neck. But even though it's small, it is quite powerful. There is not a system or a process in the human body that does not have thyroid hormone involved in it in some capacity. You can think of the thyroid gland as the body's thermostat, how it burns energy. There are two main thyroid hormones that the thyroid gland makes. One is called T4. It is an inactive thyroid hormone. It's like the storage form of it. And then there is T3, which is the active form of the hormone. So T4 gets converted to T3. It's the T3 that goes into cells and does all the things that we want thyroid hormone to do. So when it's working well, you've got enough T4 around, you're converting to enough T3, and this keeps your metabolism, your energy, your brain, your heart, and even your hair and skin functioning at their best. But what happens if it's not functioning properly? So what happens when we have hypothyroidism, meaning that the thyroid gland is not producing enough thyroid hormone? In the United States, this is usually caused by something called Hashimoto's thyroiditis, which is an autoimmune disease, meaning your own immune system is attacking the thyroid gland. How does this present? The symptoms can come on quite gradually. They include fatigue, weight gain, brain fog, constipation, feeling cold or cold intolerance, dry skin, brittle nails, thinning hair. Some people even struggle with depression and low mood related to hypothyroidism. Now, here's a very important point. Even if your thyroid lab tests read normal, that does not mean you're not suffering from hypothyroidism. Some patients have many of the symptoms that I just ran through, even though the numbers read normal. And the literature can show that those patients should be treated. Because it's not just about what your TSH or your thyroid stimulating hormone shows, or what your T4 number shows. There can be other issues going on, like problems with conversion. I like to think of thyroid as there being three main types of hypothyroidism. There's one, we'll say it's primary hypothyroidism, and this is where the thyroid gland just simply isn't producing enough thyroid hormone. So this is probably the most common. This is the easiest one to diagnose. Your doctor does some lab work. Your TSH level is very high. Why is this? So TSH stands for thyroid stimulating hormone. So you have a gland in your brain called the pituitary gland. It produces TSH that then communicates to the thyroid gland to make hormone. If the pituitary gland sees that there isn't enough thyroid hormone being produced, it will try to stimulate the thyroid gland more. So the thyroid stimulating hormone goes up. So that's primary hypothyroidism. Secondary hypothyroidism would be someone that has a problem converting the inactive form of thyroid hormone, T4, to the active form of thyroid hormone, T. Then there is what I would call tertiary hypothyroidism, where there is resistance to thyroid hormone at a cellular level. So the numbers may read normal, but there isn't enough hormone to overcome the resistance, so the patient's symptomatic. So primary, secondary, tertiary, hypothyroidism, different causes of the problem, and each of these can lead to the patient being symptomatic. So here's the big part. What do you do about it? How do we treat it? So let's talk about the treatments. The standard treatment is with a medication called Levothyroxine, brand name Synthroid. There are other brands. That's the one that is most common, most popular. It is synthetic T4 only. It entered the market in 1958 by Flint Laboratories. It is FDA approved. However, interestingly, it did not receive its FDA approval until July 24th of 2002. So for nearly 50 years, it was not FDA approved. Why did it get FDA approved? Well, in the 80s and 90s, there was concerns about inconsistent potency. So the FDA made the manufacturers submit a new drug application, like they had to bring it on the market all over again, do the studies, approve that it was a quality product, etc. That happened in 1997, and then it gets improved 5 years later in 2002. But here's the other interesting thing to think about. Let's go a little further back in history. We have been treating hypothyroidism since the 80s. But Synthroid didn't show up till 1958. So how were we treating thyroid patients prior to levothyroxine? We were using desiccated thyroid extract from the thyroid glands of sheep, cows, or pigs. These days, it's usually pigs. It is a combination of T4 and T3, and it also contains T1, T2, and some calcitonin. The ratios of the T4 and T3 are similar to the ratio that our own thyroid gland makes thyroid hormone, and the thyroid hormone itself looks similar. So for 70 years, this proved to be a safe and effective treatment of hypothyroidism. There is a quote from 1963 in the book entitled The Thyroid and Its Diseases, written by two Harvard endocrinologists, that says, diagnosis of hypothyroidism having been made, the next logical step is to give thyroid extracts. The results that follow such treatment are prompt and dramatic, end quote. So again, for 70 years, 1890s, all the way up to the 1950s, we're using desiccated thyroid extract safely and effectively. Then 1958, levothyroxine or Synthroid hits the scene. The pharmaceutical industry does a fantastic job in convincing providers that this is a superior treatment to thyroid extract. Thereafter, lab tests are created. T4 in 1960, TSH lab marker developed in 1965, then T3 lab marker developed in 1972. And the treatment plan became to give only T4, because they had the understanding that the body would appropriately always convert T4 to T3 well, and that the goal of the treatment would be to get the TSH level into normal range. So patient has symptoms of hypothyroidism. They do blood work, T4 and TSH. The TSH is high, so they have the diagnosis of hypothyroidism. They're given levothyroxine or T4. And once the TSH number becomes normal, they say, we have fixed your hypothyroidism. So seems reasonable. But what actually happened? There has been an increasing number of reports starting in the 60s and into the 70s where patients were complaining to their providers that their symptoms were not being resolved on the new medication, to the point they were requesting their doctors to put them back on the old medication, the desiccated thyroid, because they felt better. But their providers, as they were trained, said, nope, your TSH level is normal, your T4 level is normal, you're on the appropriate medication at the appropriate dose. So for 70 years, it went something like this. You go to your doctor and you say, I'm having symptoms of, let's say, fatigue, weight gain, cold intolerance. Sounds like that might be your thyroid. Here, take this thyroid extract. Do you feel better? I feel a little bit better. Well, let's give you more of it. Do you feel better? Yeah, I feel really, really good now. Okay, that can be your dose. Or maybe you would come back to the doctor and say, well, doctor, now when we raise my dose, I started having palpitations and I felt a little jittery and my heart was racing. I didn't feel very good. We may have you on too much medicine. Let's lower your dose. Did those symptoms go away? Yes, they went away. I feel good now. Okay, then that's your new dose. For 70 plus years, it was handled this way. Then we switch to where everything is based on following the lab numbers. So, Synthroid, despite all these patients complaining to their doctors that they don't feel better, they want their old medicine back, Synthroid has become one of the most prescribed medications in the United States. Based on some 2024 data, there is estimated 22 million prescriptions written for Synthroid each year. Now, let's be clear. For many patients, it works very, very well. These would be patients that don't have a conversion problem from T4 to T3. These are patients that would not have a resistance problem at a cellular level. So they make enough T4, they're given enough T4, it gets converted to enough T3, there's no resistance, and their symptoms go away. That's great. But some 25% of patients with hypothyroidism, a couple studies would say maybe even up to 40%, do not have improvement of symptoms and quality of life when they're treated with just levothyroxine or T4. And they do not feel better until there is T3, which is the active form of thyroid hormone, added in. Even if the TSH level reads normal, even if the T4 level reads normal, they don't feel better. And the literature will show that TSH levels do not correlate well with symptoms, as do T4 levels not correlate well with symptoms. So what do these patients do? What's the answer for them? Well, in my opinion, the answer for them is desiccated thyroid extract. Medications like Armour Thyroid or MP Thyroid that contain both T4 and T3, as well as T1 and T2. It comes from the thyroid gland of pigs, usually these days. No, it is not FDA approved. However, it has been used to treat patients for over 100 years. And there are currently 1.5 million patients in the United States on desiccated thyroid extract. So it has a long, long history of safety and efficacy. Now, there is a third option of how patients can be treated with hypothyroidism that have not gotten better with just T4. They can be treated with a combination of levothyroxine, T4, in combination with levothyroxine, which is T, for improvement of symptoms and quality of life. Now, in my practice, I find that desiccated thyroid extract, such as MP thyroid, is a superior approach to treating patients with hypothyroidism. We have better success with improving symptoms, improving quality of life. But for patients that, for whatever reason, aren't comfortable taking desiccated thyroid extract, a combination of T4 and T3 in levothyroxine plus levothyroxine would be a viable option. One more thing I want to mention before we close today, and that is to speak a bit about the recent FDA events. On August 6th, the FDA released a statement saying that they intended to take action against animal-derived thyroid products, meaning desiccated thyroid extract, medications like MP thyroid, by classifying them as biologics, because that would require special approvals they do not currently have. Therefore, manufacturers could not make them, prescribers could not prescribe them. They said they had issues with questionable variations in potency, questionable safety issues. So this is why they're doing this. They said they were going to give the manufacturers and the providers a year, 12 months, to get patients transitioned over to synthetic FDA-approved versions of thyroid hormone, such as levothyroxine and levothyroxine. Now, there was instantly a huge backlash against this statement because this is going to affect, again, 1.5 million patients that take desiccated thyroid extract. A week later, Dr. Marty Makary, who is the commissioner of the FDA, released this statement saying the FDA is committed to pursuing the first ever approval of desiccated thyroid extract pending results of the ongoing clinical trials. In the meantime, we will ensure access for all Americans. I'm really glad he made this statement. It, at least for the time being, put some at ease. This is a really, really important issue to follow. In my view, to take away a medication that has been safely and effectively used for over 130 years makes no sense to me at all. Now, fortunately, there are currently trials going on. One of them is in phase 2 to get desiccated thyroid extract FDA approved. Hopefully, it is successful. So, with that, we'll close today. I hope you found this valuable. Here's what I hope your takeaway is. That it's not just about the numbers. It should be more about symptoms and quality of life. And that there are alternative ways to treat hypothyroidism, meaning using desiccated thyroid extract, and not just relying on the most commonly prescribed typical medication of levothyroxine or Synthroid. So if you think you have hypothyroidism, you should have this discussion with your doctor, and you should share with them your symptoms. And I hope that your provider will listen to your symptoms, that will not just base all the decisions on what the lab tests show, that they won't just tell you, well, your labs are normal, but they'll have the longer conversation trying to get at the root of the problem and knowing that there are treatments that can successfully and safely improve your symptoms and quality of life. And if you do have the diagnosis of hypothyroidism, that just getting the numbers normal may not be enough. And remember, you're not alone, because I said the literature shows at least 25%, if not more, of patients that are treated with T4 alone do not have improvement of symptoms and quality of life until T3 is added. So with that, I hope you found this useful. I hope there were some takeaways for you. If you know someone that may benefit from hearing this message about thyroid because they're having their own struggles, whether it's a friend or a family member, please share this episode with them. And please subscribe so you don't miss all the future episodes. Really appreciate your time and your trust in listening to this information in this podcast. It really means a lot to me. Until next time, here's to living life optimized.
Thank you for tuning into this episode of Holmes on Health. If you found today's episode valuable, share it with someone you care about. And hit subscribe so you never miss a future episode. Want to get more of our content? Follow me on Instagram and YouTube at Alan J. Holmes MD. Until next time, here's to living life optimized. This podcast is for general informational purposes only and does not constitute the practice of medicine or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions.